Hello to my Salt and Light family. My name is Victoria Wilson. I'm back for part 2 of preventative health screenings. So we're going to get into each body part and how often you need to go for screening. We talked about the primary care provider. They're the glue that keeps everything together from all the specialists and everything. So talked about the importance of that. Please go check out the first video about that one. So let's talk about your eyes. It's important you get an eye exam age 19 to 64 at least every 1 to 2 years. They check your visual acuity, which is important for safety. You want to make sure you can see. You're not going to walk into a hole somewhere. They also will check to see if you have like cataracts or glaucoma, dry eye. So all those things are assessed by the eye doctor. So you should get that done. And if you're 65 and older, or if you have any chronic illnesses like high blood pressure, diabetes, and you already have glaucoma and cataracts, you definitely should go more than one time a year to get those things checked. Your dental exam is an annual exam, but your dental cleanings with the hygienist should be at least every 6 months. If you have a bad tooth or if you have gingivitis and you don't get that taken care of and it festers and sits in your mouth, it could eventually go into your bloodstream. And what happens when you have bacteria in the bloodstream, it can actually deposit themselves on the heart valves and cause severe heart disease. So good or bad, I should say, dental health is directly linked to cardiac disease, which is heart disease. So please, please, please go to the dentist and get your teeth checked. Same thing if you don't have a dentist. I know that the Philadelphia District Health Centers, they have dental appointments within the District Health Center. So blood pressure screenings is important. That's done by your primary care provider. If you have hypertension, it may need to be checked more frequently. But one good thing too is that most insurance companies, if you do have insurance, will cover you to have a blood pressure cuff. So please ask your primary care provider for a prescription for a blood pressure cuff, or to call it directly into a durable medical equipment supply company, and it will be delivered to your home. And they will go over with you what the good readings are and what the bad readings are and what you would need to do to help with your blood pressure management. Also, mammograms. Ladies, age 40, it should be your initial mammogram. And it should be done every year. It should be done annually. If you have a strong family history where a first-line relative has been diagnosed with breast cancer, a mother, sister, aunt, grandmother, you should have your initial mammogram done 10 years earlier than the age of their diagnosis. So if they were 45 when they were diagnosed with breast cancer, you should have your mammogram done at the age of 35. Colonoscopy is really important. It's very strong history of colon cancer in the African American community. The colonoscopy should be done at the age of 45. It's a very, very important screening that some people are very hesitant to get done because it's a very sensitive area of the body going into the rectum. However, I can tell you personally, it is not painful at all. They give you a nice anesthesia, you're sleeping, you wake up, you feel like you're on a cloud, there's no pain associated, but it's a part of your body that you can't see. If I had something green growing on my hand, I would say, what is that green thing growing on my hand? But I can see that, it's on my hand. Your colon is something you can't see, so it's really important that that part of your body gets examined with the scope. If your colonoscopy is normal, it's every 10 years. And if it's abnormal, if you have polyps that need to be removed, then they would have to do it every 5 years. And just remember, polyps are precancerous, so that's really important that you go for your colonoscopy. Please, please, please go. Pap smears are done age 21 to age 30 every 3 years if you do not have HPV. Once you are 30 to 65, they're done every 5 years. You do not need a pap smear before 21, regardless of being sexually active or not, and you do not need a pap smear after 65 unless you have a history of some sort of gynecological cancer. So, like I said, if you don't have HPV every 3 years from 21 to 30, and every 5 years from age 30 to 65. Prostate exams start at the age of 50. And if you have a family history, you can definitely ask your primary to do a prostate exam sooner than that. It's important to get STI screenings for sexually transmitted infections. Depending upon your lifestyle, it should be done at least annually. If you're at a higher risk group, a lot more frequently than that. But we can definitely talk about that depending upon your sexual risk factors at another time when I do another video. Once you're over 65, it's important that you get a DEXA scan. And a DEXA scan checks your bone mineral density. Ladies, when we're 20, we're standing up straight like this, and when we're 80, we got this big hump in our back. So it's really important to make sure that your bones don't have a lot of holes and are not porous. It's important to have calcium in your diet. It's important that you exercise. And believe it or not, smoking cigarettes or any kind of smoke can also increase your risk for osteoporosis and poor bone density. So that concludes my health screening according to the systems. Please let me know if there's any questions that anybody has at any time. You can always stop me at church, and by all means, or call me, and we can talk about different things if you have any questions. Thanks so much for listening, and have a great day.